As the focus of the quality improvement in nursing care continues to advance and improve in the healthcare setting, it is the goal of the Quality and Improvement Council to provide education to the clinical staff to ensure data is up to date, performance evaluations are being met, and to ensure the highest standard of care is given. As newly hired nurses in the healthcare, our main agenda is to care for our patients, making sure that we are doing what is always best for them. As part of the nurse's job, we make sure documentation of patients' care is precise to enhance the patient's safety and increase good patient outcomes. Currently, the focus and expectation of patient care is safety and quality. Hawkins ETAL 2017. To measure this, healthcare organizations and researchers have come up with quality indicators to quantify quality outcomes. Hawkins ETAL 2017. The NDNQI, or National Database of Nursing Quality Indicators, was founded in 1998 to aid nurses in improving care and safety in patients. MA ETAL 2018. It is the national data measurement to compare quality of nursing care outcomes to the hospital unit level. MA ETAL 2018. The NDNQI measures quality indicators that nursing care can influence. Indicators like central line infections, catheter-associated urinary tract infections, also known as CAUTI, falls, pressure injuries, are just a few of the indicators NDNQI measures. These measures are used to rate hospitals on their quality of care and can influence reimbursement rates. While this is not a new concept, as even Florence Nightingale herself kept track of how certain nursing practices reduce the rates of infection, the NDNQI uses this data to influence the interventions that have become known as a standard of care. Pressure injuries affect millions of people every year and can lead to life-threatening infections, pain, and costly treatment. Braden ETAL 2016. These pressure injuries have been deemed a never event, or an event that should never happen during a hospital stay, and has been determined by Medicare as a non-reimbursable diagnosis. Rajiciwick 2018. Such events have been deemed as preventable, and the rate to which they occur in the hospital setting can be measured. The NDNQI tracks this incident and the severity of the pressure injuries of patients and publishes reports of the data. Utilizing an interdisciplinary approach to chart formation and entering data, our team can increase the incidence of implementing interventions to decrease the incidences of pressure injuries. Such example would be on admission, a patient is assessed using the Braden scale to determine his or her risk of developing or worsening a pressure injury. Rajiciwick 2018. Assessments like their nutrition, incontinence, their friction and shear, mobility, neuropathy, can trigger interventions and orders in the computer built by the informatics team to alert the nurse. These interventions can help to prevent pressure injuries by highlighting at-risk patients and triggering reminders to utilize evidence-based practice interventions to decrease the severity and help cure the injury. Great tools like the Braden scale help us as nurses to know when and where we need to be applying less pressure, elevating heels, such things like that. Our evidence-based practice is what has been used for years and what nursing is measured against. Nurses and management have kept track of interventions and outcomes to determine if things they are doing are working and if or they are causing more harm. There have been several evidence-based practices that have been shown to decrease or even heal pressure injuries. Interventions such as specialty beds, elevation of extremities, turning and repositioning, incontinence care, and thoroughly daily skin assessments can help to minimize pressure injuries. These standards of care have been proven to improve patient safety, satisfaction, and outcomes. Mary Jo, a wound analyst at our hospital, is responsible for submitting this data into the NDNQI database, and the assessments that are entered into the patient's chart is the information is currently used in her data collection to report. She stated that she collects data from different areas of the hospital, and one of the biggest challenges is making sure to get the information in a timely manner, making sure that interventions and incident reports are charted in one interdisciplinary approach to accurately give the information. Once all the information is collected, it is then shared with the nursing staff via a town hall meeting, as they like to call it. Our bulletin boards are updated in an effort for quality improvement and to also celebrate in a job well done. It is extremely important as frontline nurses to utilize the charting system effectively. Making sure initial assessments are done on skin condition and Braden scores are charted in a timely manner can make a big difference. The informatics team has built a skin assessment and skin care plan to be utilized as the patient has open areas or potential for open areas. Our wound nurse frequents our floor very often. These care plans have interventions for preventing breakdowns to help aid the nurses in doing all they can to prevent skin breakdown. In its conclusion, the entire health network has to play a part in the prevention of pressure injuries and the reduction of the incidents reported to the NDNQI. As a bedside nurse doing the assessment and the prevention interventions, it is given to the informatics team setting up the programs for documentation. We all have to play a major role to decrease bad patient outcomes and to increase patient safety and get optimal reimbursement for care.